We do want to talk, though, today about the city's response as an employer and as a government to the COVID-19 pandemic. I have with me today our city manager, David Duckworth, and of course, Chief Tom Sanson, the chief of the Calgary Emergency Management Agency. And I'm going to turn it over to David. Tom will then speak, and I'll say a few things at the end. David?
Thank you, Your Worship. Good afternoon, everybody. Thanks for being here. The COVID-19 pandemic is a dynamic and rapidly evolving situation. Our top priority as the City of Calgary is, of course, the health, safety, and well-being of not only just our employees, but also of the public. We're focusing on maintaining essential services that Calgarians rely on. At this time, all city facilities remain open, and we will communicate any changes if that changes. I have asked city employees today who have the ability to work remotely to begin working remotely starting tomorrow. I have also implemented a citywide employee travel ban for all work-related international travel. It's important that we balance the seriousness of the measures we are taking with the risk of infection, which is still quite low. With those brief comments, I'd like to now turn it over to Chief Sanson.
Thank you. I think as our city manager aptly said, our top priority is the health and safety, the well-being of our public and our employees. By doing and focusing on essential services, we provide and will provide what Calgarians need. The municipal emergency plan was activated at 1:45 today. That does a couple of things for us. It allows us to coordinate our own city services better. It gives us additional powers under the municipal emergency plan to secure resources, and it gives us a better clarity in decision making, really speeds decision making. And finally, it unites the city and our essential services. I can tell you that we were doing those things before. This is a more formal step to do that and to move quickly. I have been incredibly happy with how we have been collaborating in this city. It's a testament to the people who live and work here. We are incredibly supportive of the measures the province has taken. They're now restricting large gatherings, no groups greater than 250. They're limiting travel, which is good for Alberta, and it's good for the city of Calgary. They're really on top of this, and they're working hard to keep our citizens safe. If you're seeking medical advice through HealthLink, know that it takes a bit of time to get through to 811. I'm going to ask you today, please do not dial 911 as your alternative. We're seeing people do that, and they cannot give you the answers you need. A bit of a tip, maybe. If you need 811 and you can't get in the daylight hours, go a little later in the night. Spread that call volume out for them. I know of an individual who called them at 3 in the morning and got through the whole process in 31 minutes. So we're getting overloaded with calls in 911, and we need you to allow us to focus on the emergency, the health and safety calls that 911 should truly get. Another thing, if you dial 911, if you make that mistake, don't hang up the line. You just create us more work. If you hang up the line, at least talk to us and say, I made a mistake. I should have called 811. And finally, based on the direction from Alberta Health Services, we've just temporarily closed a couple of city parks. That's Devonian Gardens and James Short Park. So what we've done is we've created a bit of a SWAT team to go out and clean our public areas and our work areas when that happens. And so those sites have both been cleaned. They're both going to be cleaned up and ready to go. And our hope is to open them again before the weekend's over.
I want to be very clear on a couple of messages. This is going to get worse. There will certainly be more cases, and we will certainly have serious cases. But there is no reason to panic. As we watch cancellation of events around the world, as we see the social media posts, as we see the inexplicable lineups at the grocery stores for toilet paper, it's easy to get very, very nervous, and it's easy and correct to be looking for answers. But I want to tell you something. If you're here in Calgary, you're in the best place in the world to deal with this pandemic. We're in a place where government works. We're in a place where we have a robust public health system, and we're going to look after one another. It's important that we keep everyone safe. ourselves, our family members, our loved ones, elderly people in the community, ultimately everyone in the community. Let me say that one of the reasons I'm feeling really grateful is I feel that we are so lucky to have the Chief Medical Officer of Health, Dr. Gina Henshaw, and her entire team, including the Acting Chief Medical of Health for Calgary, Dr. Nick Etches, working so hard and being such incredible resources for all Albertans as we navigate the early moments of this pandemic's presence. Under her leadership, under Dr. Henshaw's leadership, the province is making important decisions to keep us all safe and keep us all informed, and I'm confident that we are in good shape. Now, you know, this may seem like an overreaction. And let me tell you something, maybe it is, but it is an intentional overreaction. Because when we think about how pandemics spread, when we think about that curve and that catchphrase you keep hearing, flattening the curve, it means pushing cases out further, pushing them out for when seasonal influenza cases are no longer clogging the emergency rooms, when we have more treatment and more prevention options, and overall, not overwhelming our healthcare system. These are the things we've got to do, and we've got to do them quickly, and we've got to do them now, and it relies on everyone's participation in social distancing, in good hand hygiene, and all of that stuff to make sure that we are pushing out the spread of this disease as much as we possibly can.